Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Vanbergen.
Hello, everyone, and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Vanbergen, and today we're going to be doing our second of the year Q&A podcast episode. This is quickly becoming my favorite way to do podcasts because I get to answer your questions from the community. And this time we put up a poll on our Facebook group, and we had so many questions that I'm not even sure if I'm going to get through all of them today, but rest assured that you will have the opportunity to submit those questions again in next month's poll. As I said, we're doing one of these a month, so there's plenty of opportunity to get your questions answered by me on the spot. So let's talk about these questions. Let's sort of see where this leads us. Now, the first question I got was actually voted pretty high by a lot of people, and this was, can you increase or decrease the power level when dosing and zeroing? Now, dosing and zeroing is something, for those of you who don't know, that is part of our biofeedback connection process. So it's the way that the device sends and receives feedback from the brain. So a dose is the feedback reaching the brain, and the zero is the feedback coming back to the brain. So ultimately, you're going to need both to make that cycle happen. As far as the power level goes, we always say to set the power level to comfortable. And I don't recommend increasing or decreasing the power level when dosing and zeroing, which is why it's always important to find that comfortable or just below comfortable level. Because naturally, as treatment progresses, right, the electricity will get more familiarized with the skin and the skin will start to accept it. So where you needed more push to get through that resistance initially, you will need less. And a dose or a zero can take quite some time depending on the situation the person is experiencing. So what I would recommend is that you try your best not to change the power level. The reason is that as you increase that power level, you increase the push and you might mess up the signal, sometimes getting a false dose or zero simply through a surge of power or a change in the current that just destroys the kind of connection that we're trying to achieve. So the next question, is Scalar FDA approved? If so, for what treatments? It is FDA cleared. It's an important distinction is that the FDA only approves medicines like medications, drugs, things like that. The FDA clears medical equipment. So it is a legal distinction that we have to make here. Now, Scalar is FDA cleared, but it is cleared under a general wellness tool. So for something like a practitioner who's trying to use this in a clinic, I would highly recommend that you just bundle it in with your microcurrent therapy. Yes, it is FDA cleared as a general wellness tool, meaning that it can in some way enhance your well-being. But you can't make specific claims on your clinic's website saying, oh, Scalar can do this, 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 and this, unless you have research studies to back it up. And even then, you're not supposed to put those on your website. You're supposed to focus more on what it is cleared for. So FDA cleared for general wellness is the way that we want to go when it comes to Scalar. And it's just because we kind of got to play a little bit of the game there. And one of the things is that you just want the clearance so that they understand that, yes, it is safe to go out on the market. But once you start getting into some of the things Scalar can do, if those were clearances, it would class itself out into a completely different class of medical device that would make it extremely unattainable for a lot of people. So hopefully that answers that question there. All right, so the next question is, could we have something on how to treat bursitis? And that's coming from Matilda. So Matilda, yes, definitely. Bursitis is a condition that ends in itis, right? Itis means inflammation. So it's inflammation of the bursa. There's not really much more to that. Now, any kind of itis is going to be an anti-inflammatory therapy. And any one of our microcurrent therapy devices is going to be capable of helping with bursitis. So what you're going to be looking at doing is placing the device on either 121 hertz or blue stim or 350, anything that has anti-inflammatory capacity to it. And depending on whether you want to hold it in place or move it, and working that area for 5 to 10 minutes. The next thing I'd recommend would be something that's going to increase circulation a little bit more. So something like blue stimulation, fMRSI, those are good options for increasing circulation. But yeah, it's a pretty simple condition to be able to treat in the grand scheme with microcurrent therapy. So our next question is, can varicose veins be treated? Question comes from Jennifer. So Jennifer, yes, varicose veins can be treated. There's a bit of a confusion as to where the protocol for that lives. And it's actually kind of falls under the cosmetic protocols. So it's actually located in Cellular Makeover second edition. So if you happen to have that book, it's on page 122, and it covers both varicose veins and spider veins. And just reading from this book here, it just discusses, varicose veins being large, raised, swollen blood vessels that twist and turn. And essentially, we do see a huge amount of complaint as a cosmetic approach from this for people. How do we treat these veins and what to go with? What we're typically looking at here actually is treating the muscle tissue around the veins to strengthen and repair it. And so the appearance of the veins then will begin to diminish. Now, we know from our 1995 Siskin and Walker study that we reference so often on frequency healing, we know that the frequency required to regenerate muscles is 13.6 hertz. So if we have that, we go for that and we paint around the area. So you want to set your device to 13.6 hertz if it is equivalent. Generally, in the Genesis 2 or the Evolution, you'll be looking at 7 to 12 hertz instead as an acceptable option. If you have the Pinnacle, I would 100% recommend you program in 13.6 hertz. If you experience any discomfort with the varicose veins, you can definitely use Sanabio 14 if you have the Pinnacle as well. And you can do some anti-inflammatory with the other devices first. But Sanabio 14 would take care of the muscles as well as the area around it. So you've got lots of options. So the next question, are old scars from surgeries to be worked on first before doing any other treatment? So rule number one of microcurrent therapy is to treat scars. And there's a little bit of a nuance to this, because I can say that when I see a patient that comes in an acute state or a critical pain-like state, I often don't go and say, okay, well, which scars do you have here? Let's work through all these scars. The first thing I'm going to do is address the pain directly. But when we're looking at the possibility of long-term pain resolution, well, then in that case, yes, we're probably going to want to treat the scars first. So it's going to depend on the situation. One way or the other, if a patient came into me and said, hey, Dr. Rob, I'm in extreme pain. By the way, I've had a bunch of surgeries. I'm going to pay attention to those surgical scars, but I'm also going to want to treat that area first. So realize that you can get relief and you can get some results without treating scars. But in order to actually resolve all the underlying issues in the body, you're probably going to want to do those scars first. So when I say there's a bit of a nuance to it, that's all I mean. I just mean that it does depend on what you're trying to achieve in the moment. It's not like skipping treating the scars will mean you will be able to provide no benefit to someone. It's just unlikely to resolve the issue if you're not working on clearing that body electric, especially with old scars, because although they've been around for a long time, they may have been contributing to a lot of dysfunction for many years equally. All right, so the next question we have on here that is getting answered today is, what is the best treatment for BHP? Now, for those of you who don't know, this is benign prostatic hyperplasia, and this is kind of when you have a non-malignant overgrowth of the prostate gland. So this condition has a few different treatment options that we look to, and honestly, most likely to be the most effective is going to be simply to use Chi-Wave PEMF pad. So sitting on your PEMF pad with an anti-inflammatory program tends to help the most. I would also say that tied in that program as to what's going to work the best, Scalar, if you happen to have the Scalar device, pointing Scalar towards the prostate area on any mode at maximum power for 5 minutes before any other treatment, or as a sole treatment for this, is a good way to go. The other thing is that I've had a lot of people that have struggled to get the full amount of success they're looking for with the Chi-Wave pad, who have then opted to try the prostate electrode, which is an insertable electrode that goes into the rectum, and essentially it allows you to stimulate the prostate directly. Now, when you're doing this, you use something like 121 hertz to kind of help to drain and reduce that swollen area. But I still think that I'm going to vote for PEMF and Scalar as being the two most popular options, as well as possibly the most effective ones as well. All right, the next question we have is when you're dosing and zeroing. So again, we'll come back to dosing and zeroing, and you're getting low numbers. So what you're thinking is, let's finish the question here. When you're getting low numbers, what frequency would you use? So for those of you who dose and zero with a Genesis 2 or an Evolution, you're not getting numbers. So this question doesn't apply to you. But for those who use the Pinnacle, you're getting a screen. And that screen is going to display numbers. So as you're dosing and zeroing, and you're taking your readings, you are going to see a number. And that number is going to tell you whether the area is degenerative, inflamed, or normal. You're kind of asking two sort of questions here. There's two potential answers depending on exactly where you're going with this question. So first off, if you're getting low response, so you're not having a hard time getting the results, use a different mode that has more pulses in it. Typically, we use assess 60 hertz or 60 hertz or 77 hertz, one of those in your device to do dosing and zeroing. But if you have FM RSI and you're finding the person has generally low readings everywhere, you can use FM RSI instead as your primary dosing and zeroing mode. You can do reactions in the Pinnacle in the same way, and it's just got more energy, so it helps to boost those areas. Now, if you're talking about if you're getting low numbers, so in general, like just the readings are low showing degeneration, the first thing I would say is that unless the number is lower than 19, or it's just everywhere is around 19, I would not really worry too much about those low numbers. We typically focus on the high numbers, finding those numbers above 35, especially in their 40s plus, as the main issues that are causing those low numbers around the body. If you're experiencing low numbers everywhere, 16, 17, 18, that is the more of the concern. Between 19 and 25 is considered low, but it's not like it's critically low to the point where unless it's everywhere, it's going to be causing you issues. With those low numbers, I would be looking at using Sana Soft T, if those are everywhere, and painting over that area. This brings in the most general energy to those areas and is most likely going to provide that benefit. From Joanne, can PEMF and Scalar be used on the thyroid? So yes, they absolutely can. And microcurrent, as you may note, can't. So those of you who are just learning about this now, we don't like using microcurrent on the thyroid because the thyroid is an incredibly temperamental gland. And when we stimulate that area, we have the possibility to turn our hypo, which is low thyroid, into a hyperthyroid, which is high. So rather than correcting it, we can swing it in the opposite direction, and we don't want to do that. So it's just because microcurrent is so potent. With PEMF, so the VHE, for example, I would particularly be looking at using the throat chakra mode on the thyroid, which is CHTHR. And I want to guess 136, but I'm pretty sure I'm wrong. Let me just check in my Pinnacle here. Oh, it was close. CHTHR 141 is the name of the mode. So CH, so for chakra, THR for throat, and 141 is the frequency in question there. And so what you would do is you would use the PEMF there directly. Other modes that might be effective would be things like gamma and so on. Now, Scalar is also a great option, and 7 to 12 hertz with the Scalar is kind of the way to go there. If you have the Sanochi, I would go with the Scalar first and then switch it to the VHE right afterwards, and just kind of make sure you're getting the treatment of both in there. Okay, so the next question we have here. Can the gloves, and this is from Claudia, can the gloves and the socks be used for any other treatment besides mitochondria? If so, please tell me the frequency and the time and what it treats. So yeah, there's lots of uses for the gloves and the socks. As a combination therapy, you can use it for grounding as well. So 7 to 12 hertz for up to 30 minutes. And you can essentially lower the cellular energy, balance the pH of the body, and it can provide a lot of benefits. You can use the gloves and the socks just for sore feet and sore hands. You could use it for Raynaud's disease, which is the syndrome where you get cold hands and cold feet unseasonally. In that case, you'd want to use vaso mode or FMRSI to just try and improve that circulation as best as you can. I've even seen some people discuss, though not my protocol, the idea of using solfeggio on the hands and feet to balance the body through those musical tones. So the solfeggio mode in the pinnacle could be potentially used for this too. So I think people can get into the idea that wherever you have these varying issues throughout your body, you can look at the fact that the hands and the feet treat the entire body. And so if you want to figure out how to actually solve these issues, you can essentially just start thinking of what frequencies do what and applying them to the hands and the feet to effectively treat the whole body. I hear people being like, well, how does that work? Well, the current will travel through the nerves in your body. So if you start in your hands and your feet, this is going to extend through your arms and your legs to your core. And when you think about it, if we're an animal-based creature, when we walked on all fours, we would have been putting our hands and feet on the ground, absorbing energy from the ground, just like dogs do, just like cats, deer, whatever it may be, there is energy entering the ground and entering the body. And so we're essentially just using the same pathways that nature would use to provide us with electromagnetic fields and energy as well. And I think this is going to be our second to last question for this episode, but don't worry, there'll be plenty more opportunities to go through this. So this next question is, when you have multiple autoimmune conditions, how do you treat? So first off, I'm sorry that you're dealing with multiples. Unfortunately, it is not uncommon to deal with 3, 4, 5, even upwards of 10 different autoimmune conditions. These are just your immune system attacking different areas of your body, and it's being classed as a different name. If everyone just kind of got lumped together with you have autoimmune issues, then it would kind of cover so many different bases. Now, what this really means is that the inflammation in your body is triggering the attack of the organ systems and tissues. So how do you correct this? Well, things like vagus nerve stimulation will take out the underlying inflammation. So I would do more generalized protocols, vagus nerve stim, grounding, 3 pathways, working on the brain, calming the nervous system. This is going to be the best way to treat multiple autoimmunes. Otherwise, pick the one that symptoms hit you the hardest, right? For some people, this would be like fibromyalgia. I think this question mentioned multiple sclerosis. This one can have very debilitating effects. So picking one and focusing on one and knowing you'll get some subtle benefits on the others, but that you'll also be kind of focusing on the hardest one and getting that done first, and then moving on from there as well. Same thing goes for like mast cell activation syndrome, right? Like this can be huge and cause so many problems in the body, but one little treatment can make a big difference. All right, so our very, very last question of the episode, again, don't worry, there'll be more opportunities to submit questions, is how would you interpret an ongoing reaction of around 160 when I dose and zero the good, i.e. the pain-free limb? An ongoing reaction is a reading that we take with the Pinnacle device that shows us the consistent treatment moving through. It is not a snapshot of the true state of the area. This means that if I place the device on my shoulder, the top middle number on the Pinnacle is going to show me my initial reaction. Now, my initial reaction is a true snapshot of what it's like at point of contact before we introduce the energy to the area. And this is what we want to pay attention to, because this is kind of like your diagnostic reading. The ongoing reaction in the bottom left, this is just showing you realistically the amount of time that you've had to put in. It's the time it takes for the issue to break through and the brain to signal us back, right? So for us to signal the brain and the brain to signal us back. So when this happens on the good limb, what this is really just showing us is that the body itself is having a harder time communicating. Getting to 160 is pretty substantial, but you'll notice that you don't start too far off of that, like in the grand scheme of things. So, for example, if I were to place my device on my hand, I will start at a 22 in the middle, but I'm already just a few seconds in up to a 26. So with the fact that the counter is going to keep going up as that reaction keeps changing to the electricity of the device, we recognize that getting to 160 doesn't really mean anything If the initial reaction on the good limb was 160 or 80 and it was considerably higher than the other side, we'd likely be dealing with referred pain, and we would probably be better off focusing on that side anyway, which we're already doing if we're doing the good limb technique. Okay, so hopefully that answers your question. And to everyone who submitted questions that did not make it through today to this episode, I will be keeping those on file. And of course, we will be doing another poll in our Facebook group next month, asking for more questions for these episodes. Again, I hope you're enjoying them. There's a lot that we can do with this Q&A session in answering all of your questions. Again, chances are you've asked one of these questions if it's in your mind, and based on the voting, I'm seeing this the same. It's in someone else's too, right? There was very few options where one person put an option on and other people weren't saying, oh, I'm also interested in this. So I look forward to doing future episodes, answering your questions and getting you the solutions you need to resolve your chronic pain. So again, thank you everyone for joining me today. You are listening to Pain Free for Life. I'm Dr. Rob Vanbergen, and I'm very excited to continue these episodes and see you in the next one. Take care, everyone. Bye-bye.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.